Good day, everybody, and thank you. We're so glad to have you join us for this webinar focused on digital equity for veterans, especially after we honored our veterans yesterday. My name is Adrienne Furness, and I'm the Executive Director of the Benton Institute for Broadband and Society. For those of you who don't know us, Benton is a 43-year-old nonprofit that focuses on broadband policy, working to make sure everyone in the United States can use and benefit from high-quality, affordable broadband. We do that by strengthening local, state, and national leadership, and we provide them with timely information, rigorous evidence, practical guidance, and advocacy that is needed to articulate and implement a broadband for all agenda. We've been working for the last several months with the Department of Veterans Affairs, specifically their Office of Connected Care and their Office of Rural Engagement, to understand how states are working to address veterans' broadband and digital technology needs. The VA has been focused on telemedicine and other technology-enabling approaches to serve veterans. And at Benton, we've been analyzing digital equity and digital opportunity plans to see how states address a wide range of issues around affordability and education. Today's webinar and the launch of our report called Veterans and Digital Equity: Planning for Success are the results of our collaboration with the VA. I want to thank my colleague, Reed Sharkey, who co-authored the report with Dr. Leonie Hayworth, Leslie Roos, and DeAsia Nichols, all of whom are doing such important work at the VA. I'm excited to get into this discussion and will now ask Reed to introduce our panel. Thank you, Reed.
Thank you, Adrienne. And thanks everyone for being here. I'm going to be introducing our panelists in a few moments, but I thought I'd start by giving you a quick preview of the report that we released yesterday. As you all likely know, the Digital Equity Act, signed into law as part of the Infrastructure Investment and Jobs Act, set aside $2.75 billion to address barriers to broadband adoption, public access, affordability, and digital skills. It also names veterans as one of the covered populations under the law, groups who face particular barriers in using technology for their needs. For our report, DeAsia, Leslie, and I analyzed the digital equity plans of all states and territories in the country. We wanted to understand what were the specific needs of veterans. What do states need to address? Previous research has found that veterans are more likely than non-veterans to cite a lack of a computer or an inadequate computer as the primary barrier to subscribing to an internet service. Veterans living in rural areas or in low-income households face barriers, and veterans are an older population, a majority over the age of 65. Having established these needs, we also analyzed state and territory digital equity plans for key strategies adopted that thoughtfully address veterans' needs. We found 5 key strategies across the states. States who are doing this thoughtfully link needs assessments to their implementation strategies, leverage other state and federal agencies, identify specific standout partners, design a workforce strategy for veterans, and finally, prioritize access to healthcare. We'll return to these strategies in depth as we begin to talk to our panelists, and please download the report from the Benton website. Last note before I introduce our panelists, I want to invite the folks watching this on YouTube to submit questions, and I'll keep an eye out and bring them into the discussion as I can. First, I want to bring on our partner in this work, Dr. Leonie Hayworth from the Office of Connected Care at the Department of Veterans Affairs. Dr. Hayworth is the Office of Connected Care's Deputy Director for Clinical and Telehealth Services. She combines her clinical and research experience to help expand telehealth services to the 6 million veterans who rely on the U.S. Department of Veterans Affairs for healthcare. Dr. Hayworth, could you begin by talking about your work broadly in serving veterans and where digital equity intersects with it?
Thank you, and it's great to be here. And happy Veterans Day to our veterans yesterday. We're so grateful for their service, and wonderful today to be discussing strategies where we can reach out to veterans and really plan for success around broadband expansion and connecting all veterans who wish to be connected. So here at the VA, at the Office of Connected Care, our mission is to develop virtual tools for veterans to engage in healthcare. And so for us in particular, because we have about a third of our veteran population who lives in a rural area, it's really important for us to be able to offer veterans options as far as how to best and most conveniently access their healthcare. And so veterans have a number of options to do so in their local catchment. And telehealth is one, either in the home or at a site nearby. And so we've been asking ourselves a lot of questions, particularly about veterans in rural and underserved areas and how we can best reach them. So first, of course, there's the connectivity question, which we will be discussing in great detail today. So look forward to the input of others as we do that. Then, of course, there's the hardware question. How do we actually get a device into a veteran's hands? And we began to think about this question before the pandemic, actually, in about 2017 to 18 to 19, as we began to build our Digital Divide Consult, which is a program that puts tablets that are loaned from the VA into the hands of veterans in order to do video telehealth. So this enables veterans who have access to cellular signal to have one of these cellular enabled tablets loaned to them through the VA in order to pursue telehealth appointments with their team. And we formalized that in 2020 in a major effort to bridge the digital divide in something that we call the Digital Divide Consult. And very exciting that a number of those consults, over 170,000 of those have been completed since then, with over 100,000 tablets in the field, in the hands of veterans using them for healthcare purposes. So that is something that we worked closely with the Federal Communications Commission to integrate the Lifeline program and then the Affordable Connectivity Program, ACP, into the consult to ensure that veterans had the opportunity to understand what they might benefit from, what they might be eligible from under those two programs, and have since narrowed it down to the Lifeline program. So this is one thing that we're very proud of, that we have been able to bring to veterans and offer to veterans as an option. The other thing, and we'll talk a little bit more about this as we go on, is the ATLAS program. And ATLAS stands for Accessing Telehealth Through Local Area Stations. These are telehealth access points in rural and remote communities where veterans can access care at a non-VA site. So, for example, a veteran service organization or a community center, where these sites have been fitted with equipment and with furniture in order to ensure security and privacy and a tuned environment in which to have a telehealth visit with the veteran's healthcare team. So this allows veterans who may have a distance to travel to reach their VA, or may not have the option of a quality connection at home, may not have a device at home, or may not wish to be at home. Home may not be the most therapeutic environment for them, to seek out an ATLAS site, which is in a select number of locations across the country, in which to engage with their healthcare teams with telehealth. Each of our ATLAS sites has support embedded by way of somebody who is available on site to actually assist with the connection and assist with anything that might happen with the technology. So as we speak about digital skills, as we speak about comfort with technology, these ATLAS sites also serve to address those needs as well. We're also excited because over the past few years, VA has embarked on an initiative called Virtual Health Resource Centers, which are now live in all regions across VA and over 50 medical centers. And what these resource centers are are physical locations within a VA facility that can offer support for digital skills, teaching, strategies for veterans to really learn how to use the technology and feel comfortable doing so, hand in hand with somebody who can walk them through the process. So this is not only available to veterans, but also staff members as well. We know that if a staff member doesn't feel comfortable with the technology, it's difficult for them to offer any type of services to their patients. So we brought into veterans and also to VA staff members. And this could be in-person support, as I mentioned. It could also be support that is remote. So everything from turning on a device and using a device to the more granular details of a test video call or how to use our eHealth portal, My Healthy Vet. All of these things are addressed at the Virtual Health Resource Center and really serve as a complement to everything happening in the community when we speak about digital skills, digital equity, and really reaching out to veterans as a covered population.
Thank you, Dr. Hayworth. Now I'd like to bring on the rest of our panelists, who I will mention are all from states or organizations that we highlighted in our report. First, Dr. Lindsay Thurgood, the Digital Access Program Manager for the Utah Broadband Center. Next, Mark Casper, the President and CEO for National Veteran Serving Device Refurbisher and Digital Skills Training Organization, Tech for Troops. And finally, Walter Prescher, who is a digital navigator and bridging apps rep at Easter Seals Greater Houston. I'd love for each of you to spend a minute or two describing your role at your organization and your work with veterans' digital equity issues. We'll start with you, Dr. Thurgood. Thank you for being here.
Thank you so much, Reed. It is really a pleasure to be here today. My name is Lindsay Thurgood. I am the Digital Access Program Manager for the Utah Broadband Center, a division of the Governor's Office of Economic Opportunity. In my role, I'm part of a team that oversees and administers federal grants provided by the National Telecommunications and Information Administration, or known as NTIA. This allows us to provide infrastructure, broadband, internet services, and digital access resources for all Utahns. In my role, I have the opportunity to work with federal and state government partners and nonprofit agencies to provide programs and resources to support digital equity and access to individuals and communities across our state. Thank you for having me.
Reed, you're on mute.
Excuse me. We'll go to you, Mark.
Thanks, Reed. I appreciate that. Lindsay, good job. Hey, my name is Mark Casper. I'm the President and CEO of Tech for Troops, and we have a couple of programs that I think you'd be interested in. The first is that we have a suicide prevention program called Game Core. It uses Discord and Twitch to create that community and that triage so that we don't have any veterans or their spouses or their family members do the unthinkable. And we've saved 14 lives in the last 16 and a half, 17 months. Really, really good program that we have there. The other thing that we do is workforce development. We have veterans who come in, they learn how to use a computer, we ship computers out, and every veteran, spouse, and child gets access to 5,000 free classes online for you to elevate yourself to whatever you want to do, whether it's in Microsoft Office or through Adobe and Acrobat, or to just keep going for 5,000 classes. So those are the basic computer literacy classes and computer support that we give. There's a lot more, but it's not part of this call.
Thanks, Mark. We'll go to you last, Walter.
Hi, my name is Walter Prescher. I am a digital navigator with Bridging Apps, a program of Easter Seals Greater Houston. We are one of 18 sites as part of the National Digital Navigator Corps through the National Digital Inclusion Alliance, serving rural communities and the protected populations. I specifically work with predominantly veterans, although I work across all rural areas, helping clients do a threefold process of getting them connected to the internet if they don't have affordable internet, helping them source low cost or oftentimes through our grant free devices, and then do all the digital skills training to get them up to speed to use their devices to the fullest extent.
Great. Thanks, Walter. Thanks to everyone for being here again, and we'll move now into our panel discussion. I have some initial questions for each of you. First one is for you, Dr. Thurgood. From a state perspective, how did your office approach planning and understanding the needs for veteran populations?
Excellent. Recognizing that the spectrum of veteran needs are broad, unique, and vary from service member to service member, we try to ground our approach in evidence-based methods to ensure that we're delivering the best programs possible, and that we're delivering things that really are meeting the needs of the veteran community that we support. So according to some research by Thompson, McLean, and Roach, veterans programming should focus on 7 factors of well-being. And we've tried to incorporate those as we've done our planning in the past and in the future as we move forward. Those 7 factors include employment and meaningful activity, finances, health, life skills and preparedness, social integration, housing and physical environment, and cultural and social environment. Workforce development and digital skills, one of the things that we focus on at the Utah Broadband Center, are important entry points to help with holistic well-being for veterans. We know that employment stability helps support stability in other areas of well-being, such as housing and finance. So how can we capitalize on digital skills and experiences to support inclusion and retention of veterans in the workforce? We know that approximately 92% of the jobs that are out on the market right now require digital skills, but approximately 33% of our workers feel that they lack some of these digital skills and abilities. So as we're thinking about this is what we would call the digital skills gap. So that gap in between what employers and what the workforce wants, and the skills that we're bringing as potential employees and current employees. So because digital skills and technology are ever evolving, it's important that we use a multifaceted approach to supporting veterans and digital skill development. So this will require that we ensure that we are providing affordable, reliable, safe broadband services and access to those services, that we provide access to devices that meet the needs of our veterans, that we provide cybersecurity awareness so that you can be online and access online in a safe way. We want to make sure that we understand individuals' digital skills range. Some of us might be very introductory abilities and skills, and that can range all the way up to very advanced skills. But with skills ever changing and technology ever changing, it's important that we're staying abreast of all of those new technology developments and staying fresh on technology to be able to navigate effectively. So we would advocate for continued training in basic, intermediate, and advanced digital skills, and to incorporate digital skills training into professional development. We do know that during points of transition in employment, that can be really challenging for a veteran. And so we advocate for including digital skills training in that process to help make the movement from unemployment to employment as smooth as possible.
Great. Thank you so much, Lindsay. That was, I think, really great for kind of table setting our discussion. You really preempted a lot of the things we're going to talk about, so I appreciate that. Another important finding was that states who rose to the top in our analysis were able to pinpoint specific partners and their reasons for working with them. Mark and Walter, I would love to hear from your perspectives. Did you have an opportunity to engage with the digital equity planning process in your states? And if so, what was that process like?
I'll let Walter go first.
Our digital broadband development office is part in the state of Texas, is part of our state comptroller's office. Early on in our grant, we had the opportunity to actually host the comptroller and his team to come in and listen to the impact stories of what we're doing in the field. What we discovered through many of the roundtables was the initial idea of, or initial direction they were going was getting connectivity out into, especially in the rural communities, but they were missing the fact that if you don't have the device and you don't understand how to use the device, you still can't get connected. And so we were able to demonstrate the importance of that. One of the jokes that we have among some of the other digital navigators in the National Digital Navigator Corps simply is that the role that we do is 80% social work and 20% tech support. And so it is critical to make that one-on-one connection to demystify the digital skills. And so not only have we done education with our broadband development office, but we've also worked in with connecting with social workers at the VA. We have our own veterans assistance team that does mental health and other things with Eastern Seals Greater Houston, as well as many of the county veteran service officers and the Texas Veterans Commission and their employment and other avenues to explain what we're doing and to build those partnerships to have that referral network so that we can help vets in our rural communities.
And I would echo a lot of what Walter just said, that, we did talk to the digital equity folks. We actually invited them in and up to the secretariat level to come in and see what Tech for Troops does and how we do it. And then, if I remember correctly, and it was probably 5 months ago, so, memory gets a little fuzzy. I think they all came in when we had a class going on of veterans. So they got to see and hear exactly how we do what we do. And then we walked them through the whole location, the whole facility, and showed them the refurbishment process, the wiping process, the data destruction process, and how we actually get it out the door as well. So it ran the whole gamut for us. It was 100% involved, and we're still involved. I just had another call last Friday with the digital folks, and we're moving forward to make the rural areas of Virginia and beyond inclusive, so we can all have our veterans and others have computers.
Great, thank you both. Turning back to the state perspective, this one's for you again, Dr. Thurgood. One of the findings was that our states who had strong approaches to meeting veteran needs were those that were able to leverage partnerships with other government agencies. Can you talk about any intergovernmental efforts in digital equity planning in Utah?
Absolutely. Over the last 20 years, I've had the privilege of working and supporting veterans in higher education settings and nonprofit settings. These experiences has taught me that not one agency can't do it all. As much as we would love to, we only have so many resources, so much time, so much energy in the day. So, taking into account, yes, we can all do what we can do, allowing that opportunity to leverage and work with other agencies provides a great opportunity for us as an agency to specialize and really develop that exceptional level of service and exceptional level of focus for a skill and for an area. And then building on that and being able to take all of these great abilities and skills that we have within our community, we just can do so much more together than we can do as an individual agency. We have a really great example from the Department of Workforce Services. They've done a really excellent job in administering the Veterans Employment Service Program, and they have done a really, really great job of incorporating a lot of different organizations and voices to really be a gold star level example of how to leverage community partnerships and government agencies. The division's goal as the Veteran Employment Services is they're there to retain and to obtain employment for our veterans. So they have a really diverse set of services and programs that they offer to meet those varied needs. And under the Jobs for Veterans State Grant, DWS coordinates employment, job placement, and training programs to connect veterans and employers within our community. This requires really extensive statewide communication and statewide collaboration. They partnered with the Utah Department of Veteran and Military Affairs, Employment Coalition. Pardon me, sorry, I got tongue-tied. Employment coalitions for veterans, military service members, and their families, the Utah State Military and Veterans Affairs Legislation Commission, and the Salt Lake Military Advisory Commission, and then a variety of nonprofit organizations that provide veteran services. So, I really believe that when we leverage these partnerships effectively, we allow organizations to really provide that exceptional service within the scope that we can provide. I think as we're thinking about best practices, I visited with my team and we were discussing what does best practice look like when we're leveraging these agency partnerships. It means that we have to have all of the important voices at the table. We need to invite all of the agencies that may be involved in these decisions and these programs and the implementation. We need to get feedback and include those voices as we're planning from start to finish. What we have found in Utah is that we frequently hear this is the Utah way. The Utah way means collaboration and working together to achieve greater outcomes. And so that means that we have to have involvement and we have to have buy-in from day one of a project so that we can turn a great idea and a great collaboration into a great outcome and a great program and a great service. We focus on sustainability. We don't want this program to just be something we do once and it's a great program, but it doesn't have that momentum to be able to continue. We want to build our programs into our existing services so that they do have that staying power. We want to identify opportunities to share assets and resources. Like I mentioned, no one program can do it all, and being able to share resources and assets and abilities will really help us to take our programs to the next level. And then lastly, listening and incorporating feedback. We may have some great ideas and great starting points. It's important to take feedback and to make those adjustments. And I think that's really how you make your program exceptional.
Yeah, that's all great stuff there. And I really appreciate you bringing up the workforce development plan. We thought that was a really unique facet of the Utah plan and just a great thing to highlight and showcasing the cooperation that is possible between agencies when you're really thinking thoughtfully about how to serve veterans and any covered population. So now let's move to a broader panel discussion. And I'll invite you all to, if there's a question you want to get in on that wasn't directly addressed to you, please feel free to hop in. In our review of state digital equity plans, we found that many states noted the intersectionality of covered populations. For example, we noted earlier that a majority of veterans are over the age of 60. Dr. Thurgood, could you speak about the importance of understanding the intersectionality between covered populations, particularly veterans, in the planning process? And Walter, I'd also love to hear from you on this question, since, as you mentioned, Easter Seals works with a variety of covered populations.
Walter, if you'd like to go first, I'm happy to come second.
Sure. Easter Seals, we are probably best known for the work that we do with individuals with a variety of unique disabilities or special abilities, as I would prefer to say, as well as veterans and their families. With that, we have a lot of different programs in place to meet unique needs. One of the things, like the team I work for, the program I work for with Easter Seals, is specifically focused on adaptive technology. We have a speech therapist on site that does augmented and alternative communication, getting your tablet to talk for you. They do eye gaze programs. We have an adaptive technology lab where you can come in and test out all the equipment before you were going to go to buy it. We do digital education across all sorts of protected populations. We work very closely with our veterans teams, and are constantly seeking out people that are in these protected populations to listen to their stories, hear where they are, and then find the appropriate workarounds for them to be able to use technology to their fullest extent. Where we got our start was actually on our own website, where we have a database with about 2,200 apps right now, all peer reviewed from the viewpoint of various disabilities. So you can go to the bridgingapps.org website. You can type in autism or dyslexia or different whatever disability you can come up with. It'll give you a list of applications for your phone or your tablet specifically geared towards we're overcoming some of the challenges with those disabilities. And we do all that kind of education on a regular basis.
So what we've done, the NTIA has 8 covered populations that they're focusing on. And as we've been working with our collaborative partners, specifically for this project, Department of Workforce Services, they had identified 13 covered populations that they had identified will be or have a higher likelihood of being impacted in the job market based on these characteristics and criteria. And so it was really interesting to be able to look at these and see how most of the people that we're serving, there is a high level of intersectionality between identities. And I think it's really important as the researcher in me, we quantify people and we report and we have numbers and data. But in practice, we understand that there's a high level of overlap and a high level of intersectionality. And recognizing that intersectionality and honoring that intersectionality, I think really has a benefit for our programs to be able to look at complexity and to look at different areas of service that maybe were not initially as obvious. And it's been a really rewarding process for us to go through, by looking at the complexity of identities. So within our covered populations, aging individuals that you mentioned. So in our characteristic, that's anyone 65 and older. 51% of our veteran population in the state of Utah falls into that category. And so as we're thinking about our aging category, some of the things that we've thought about are, oftentimes this group may be ready to start to exit the workforce. But oftentimes what we're seeing now with multi-generational families and new family structure is these individuals, these veterans, are ready to come back into the workforce, or they're looking for a transition to maybe a part-time position, or maybe something they're doing from home. And so we're seeing a lot of workforce happen within the population in that 65 and older category. And so I think what our question needs to be as providers is, what does that training and what does that digital skills accommodation and support look like, so that these individuals can be successful in the workplace, in their new positions, through this transition process. One of our other categories is individuals with disabilities. We know that 32% of our population in the state of Utah has a service-connected disability. And so this would be thinking about what assistive technologies, what digital skills training, what device accommodations might look like to help that service member achieve independence in their daily life and also in their work and professional life. We know that we have a large population in Utah that live in rural settings. So in Utah, we're a little unique. 90% of our population are located within 5 urban counties in the state. Those urban counties make up 1% of our state landmass. And so we have a large, almost the entire state is either rural or frontier population. And density demographics. And so, we know that our job force, our environment, our digital access looks very different in a rural setting than it does in an urban setting. And how can we ensure that just because you live in a rural setting, that you still have full access to all of the benefits of workforce, of education, training, of digital access, of digital skills. Lastly, incarcerated and recently incarcerated individuals and individuals living within covered households, meaning that they fall within 150% of the poverty index. What we found is that there's a lot of opportunity within the work that we do to help create stabilizing and stability factors along the lines of workforce digital skills to help them be ready to enter and re-enter the workforce, and to be able to help provide some stability and some of those other factors of well-being.
Thanks so much to you both. First off, I think it's so important to have organizations like Easter Seals who employ digital navigators who have specific experience with the covered populations that they're serving, and then the experience of a digital navigator and having knowledge of the Digital Equity Act and just experience in both of those areas, so you can deal with people who are members of multiple covered populations rather than having a one size fits all approach, which I think you articulated well, Lindsay, in going through why it's important to address the intersectionality of covered populations and then move toward crafting solutions that specifically work for each group, so that no one is being shoved into a box that doesn't adequately serve them. So next question, I'll go to Dr. Hayworth. I want to highlight some specific strategies and use cases for veterans digital equity programming. And of course, telehealth is widely talked about as critical for all rural populations, but considering the mental health needs of veterans, telehealth can be life-changing, even life-saving. I'd love to hear from you about veterans and telehealth. Dr. Thurgood, Mark, and Walter, please feel free, as I said, to add to the discussion. But love to hear from you first, Dr. Hayworth.
Thank you, Reed. And critical to this piece with looking at telemental health is the understanding of studies that have been done before that have compared the outcomes amongst veterans receiving mental health services in person with veterans receiving those services, the mental health therapy and treatment, by video. And so these studies, multiple of them, and specific to PTSD, depression, and more, have shown that delivering those services by video is just as effective as a veteran receiving those services in person. So now this makes the conversation even more critical about how we then facilitate access for our veterans who prefer or who may find it more convenient to receive mental health services by telemental health, either in their homes or at non-VA sites like the Atlas sites that I talked about before. One recent study by VA researchers showed that veterans who had a tablet, one of the VA loan tablets that I discussed earlier, through our digital divide process and our digital divide consult, those veterans receiving mental health services on the tablet were actually less likely to present with suicide-related behavior or suicidal ideation to the ER. And so what does that tell us? It tells us that there is a need for this. It tells us that the outcomes that we're able to deliver by video are excellent, and that they really are meaningful for veterans who need these services, and particularly our veterans who may have more serious mental health conditions. So the question is, how do we make sure veterans are offered these services as a potential option for them to be able to pick up and run with? And so it really highlights the criticality of all the work that is being done by the panelists who are representing today. So really understanding the strategies that are needed at the state level when we think about the money that is being put forward in the state plans and how to best put those to use. And our nonprofit partners in assisting in these areas and making sure that we can actually put devices into hands of veterans and make sure that they know how to use them across the board. So our Atlas program also serves in the regard of areas where broadband will still be difficult to penetrate in those highly rural and remote areas. But really excited for the expansion of broadband and the promise of really connecting veterans in their homes and offering them the option, particularly for mental health services. That is such a critical piece of the care that we provide at VA. We know when we look at care that's being delivered by video, mental health, telemental health, is amongst the highest of services delivered by telehealth. So again, really speaking to our ability to be effective remotely in that clinical area. And again, highlighting that critical need to get broadband out there, to make sure that veterans know how to, once they're connected to broadband, use their devices and plug into VA Health in a way that is preferable and more convenient for them.
If I could chime into exactly what she said, Dr. Hayworth, you're spot on when you said that the telemental health is critical. We find the same with our game core, and as the analogy, not even analogy, the real life issues that happen. A man or a woman who's going into crisis at 1 o'clock in the morning does not have time to wait till 6 o'clock, 8 o'clock, 10 o'clock in the morning, and to be able to telehealth in and talk to a provider, somebody who's going to listen to them, will probably save their life, which is key and critical, which is what Tech for Troops does in Game Corps, but actually the VA does it as well, but on a much massive and larger scale. I think personally, applaud you for making that happen, for having that happen. And I thank you from the bottom of my heart for my brothers and sisters who go into crisis and who need your support for this, because aiming for zero is our tagline. Zero is the only number.
To further build on that, other members of my team work with a inpatient rehabilitation center in the greater Houston area that has a lot of homeless population, and they're predominantly all veterans, and most of them have had the VA tablets, and they've seen how critical it is for them to be able to overcome addiction, to overcome the challenges that they face in life in order to take those steps to get back on their feet, back to rejoining the workforce. The other thing I don't think that a lot of people don't realize, especially when you're talking about your Operation Iraqi Freedom and Operation Enduring Freedom veterans, a lot of us have either had difficulty traveling on the road. I can speak from my own experience. I lived 54 miles from a VA hospital when I was living out in a very rural community. When I walked into one of my therapy sessions, my therapist asked me immediately, "Why do you look so tired and stressed out?" I told her about every piece of trash on the side of the road bigger than a Coke can and where it was, because
There you go.
I was so used to scanning for IEDs that's all I could do. So in order to go to counseling was extremely stressful. Telehealth, had that been available at that time, we're talking 8 years ago, would have reduced a lot of the PTSD symptoms, a lot of the stressful situations. It is critical in saving lives and reducing the stress of getting the help you need to be able to move forward.
And I hear that from my patients all the time, exactly what you said, is, really that's why we want to make this an option for all veterans who want to engage in it. And, it may be that some of it is comfort as well. So as you said, a therapeutic environment may not necessarily be a trip into a facility, but rather the comfort of your own home, or if home is not a therapeutic environment, an Atlas site, those non-VA telehealth access points that I mentioned. You can see what those look like and learn a little bit more about those at connectedcare.va.gov. If you look in the chat, we have that as a link. The other thing for veterans is, particularly veterans who are more recently separated, they may be trying to really integrate into the civilian world, new jobs. They may have children, childcare may be an issue. And so telehealth offers them a convenient option to get their care maybe at a lunch break in the workplace, or at home if childcare is difficult to come by, or if a veteran is also a caregiver. offer some flexibility in that realm too.
Thanks you all so much for sharing all of that. I think that was just a lot of rich stuff in there. Thank you so much for sharing your experience, Walter. And really, yeah, just great stuff all around there. In our analysis, we also found two opposing themes around cybersecurity. Some states who identified veterans as having a higher need in this area, while others point to veterans as a potential workforce for cybersecurity. I'd love to hear your perspectives on that. Let's start with you, Mark. I know that you have trainings.
We do actually. Thank you for this. I don't see an issue with veterans in cybersecurity in any way, shape, or form. I don't think we are more paranoid or more susceptible to scams, spam, phishing, and all the others. I mean, honestly, I've fallen for it here because a lot of it looks so real. I think would be really, really good is if we gathered together and came up with a really good training for veterans at the VA to take on their own, telehealth wise, right, on the tablet, so they would understand what phishing and spam and scam and all those other things are, because there's new ones. I get them from my employees, right, that are saying, hey, I need to change my bank account from this to that. It looks real until you look into it. The first one I got, I almost fell for it. Good thing I didn't, right, because that employee would have been a little frustrated at me. So I get it. And then the other part of that is veterans who want to go into cybersecurity. Absolutely. And the last I heard, there were 43 different cybersecurity roles, everything from the project management piece to it to, yeah, Lindsay, 43, project management to the actual, what are they called, pen testing, and so much more. And it's just growing by leaps and bounds because now you have AI in there as well. If you are IT bent and you want to get into cybersecurity, you don't have to be a professional pen tester. You don't. There's so many other things to do. And the offering and the options that we're giving vets allow them to do that, right? So you look at our 5,000 free classes online, there is classes in there for you to take to build your skill set. We're also doing data center training for technicians. I don't know if you guys knew it online or wherever you're at in the world, but Virginia is the location for data centers in the world. There are more here than anywhere else in the world. So there's a desperate need for data center technicians. And the part that we're trying to do is companies get a tax break when you hire a vet. Well, guess what? We're going to have the vets come to us, learn how to work in those environments, and then be able to get a job making good money. And that's what we want to do. And then we want to get into additional trainings as well. And we're going to get into additional trainings. So cybersecurity and vet, it works. There, as Walter was saying, you scan for things, right? And having never done that, Walter, I give props to you. And I was laughing because I've had others say the same thing, right? That they're like, what's out there? What's going on? What's going on? Right. But with that being said, you're always on the lookout, and cybersecurity would be the perfect place for someone like you who has that skill to look and see the anomalies that are going on, because that's what cybersecurity is the anomalies that are out there that are incoming from your location or for your location, right? So Dominion Energy here in Richmond, HQ'd in Richmond, is the most attacked power supply company in the world. Why is that? Well, because Ashburn, which has all the data centers, along with Richmond, as well as the Pentagon, are all supplied power by Dominion Energy. So they're all being trying to hack into there, and it's one of the most secure places in the world. And that's the good thing. And they have a very, very, very strong veteran employee resource group. I just talked to them today at a different panel, and they love the military because of what Walter and others bring to that those jobs, is the skills that are not taught in the civilian world. In the civilian world, nothing against, you don't scan the trash for the side of the road to see the anomalies. What you're doing is you're doing your own thing, and you're on your phone while you're driving or something along those lines. Stop that, y'all. Just stop it, please. But you're not taught that. In the military, you are taught that. So absolutely right, Reed. Veterans and Cybersecurity is a match made in heaven, and Tech for Troops is working to implement that so we can get more people, more jobs.
Thank you so much. That's a great pitch for those folks who are looking for a way to get into the
Yeah.
field. And yeah, I think that I side on that that side of the fence when it comes to that dichotomy that we addressed in the report. Finally, I'll go to one last question before we move to the questions in the chat. I think we have at least one, maybe a few more. In our analysis, we identified that states tailored digital skills training programs for veterans in their plans. Walter, could you share more about customized trainings that Easter Seals offers to veterans, specifically ones with disabilities?
Yeah, so kind of building off what we've been talking about throughout this whole program, everything we do is a holistic approach. It's not just understanding their base needs, but like I said, 80% of our job is social work. So actually listening, guiding, asking, leading questions to kind of develop out some of the information that we need. And then through that, we're able to not only get them connected to the right ISP, to get internet in their homes if they don't have it, help them actually get the device that they need. And we've actually handed out, I think this year alone, 46 laptops to veterans and individuals with a need for it. And then doing all the follow-up digital skills training. One of the things that we see on a regular basis are several of the other vets that I've worked with, similar to my own self, have traumatic brain injury from their experiences in Iraq and Afghanistan. And so we're able, as part of that digital skills training, to teach them how to adjust the settings on their phones, adjust the settings on their laptop to make the laptops or their tablets or whatever devices they're using much more comfortable to use. You would not think that the regular brightness of your screen would be traumatizing to somebody, but a lot of people, that blue light is extremely hurtful to their eyes. So we're able to teach them how to use their settings. The ones that's a little complicated for, we're able to teach them how to use a free program that's out there called Morphic that gives you a toolbar that gives you access to all your adjustable settings. And then on top of that, then as part of that holistic approach, we listen to their needs. We actually have a veterans team as part of Easter Seals Greater Houston that has counseling for veterans and their family. We also have financial literacy classes, and part of that financial literacy group, they've helped 32 families in the Greater Houston area close on their first home this year. And so it's the whole development is on that holistic approach to, you may initially come in with one need, but we're going to listen across the board to start fleshing out all the different ways we can help you get on your feet, help you live out your most wholesome and fullest life possible by meeting as many needs as possible over the course of time that you're a client with us.
That's
and
great.
at the VA, how this has looked is with the growth of pandemic related video telehealth in 2021, we said every VA facility should offer a video test call program so that veterans scheduled into video appointments had the option to make sure they knew exactly what to expect and had a step-by-step process where a technician could really walk them through those details to ensure that they would have a successful video call. What we also do with our loan tablets is we have a squad who call every veteran and offer them a soup to nuts type support as far as support turning on the device, looking at apps, testing them, test call, etc., to make sure that our loan devices are put to good use. After all, veteran with a device in hand has to know how to use that device. And we also have a national help desk where veterans who are having any trouble, need troubleshooting support, any tips, can call. And that's our Office of Connected Care Help Desk, which is a national resource. This, of course, is all offered now through our virtual health resource centers. Again, physical locations in VA facilities that offer these digital skills training for all tools that we offer here at VA. And we'll put that link in the chat where you can learn more about our virtual health resource centers.
Thank you both. I want to get to the question we received right at the beginning of the call from Jason Hardebeck, and I'll put it up on screen now. It's for Dr. Hayworth. veterans were one of the largest participants in the ACP, and telehealth is a key strategy for the VA. Can the VA prescribe connectivity, devices, training, and cover costs? To elaborate, not just help accessing benefits like Lifeline, but actually bear the entire cost of connectivity. Telehealth savings alone should provide positive ROI.
Jason, that's a great question. And with our digital divide consult, we have tablets that are loaned to veterans that are cellular enabled. And so VA does cover the cost of the device. It's a loan device, so we expect that when veterans are finished using it, they will return it to us for refurbishing so it can be passed on to the next veteran. But we do cover the costs of the internet access for that particular device. And we agree. A broader conversation about how we can ensure affordability to broadband will be critical. So as we talk about veterans as a covered population, and Dr. Thurgood mentioned a number of strategies, and other covered populations as well, it's one thing to be able to deploy infrastructure to rural and remote areas to make sure veterans have that access, but actually making sure they can afford the access to make sure that it's meaningful. So I think our digital divide consult and our tablet program is one step in that direction, and looking forward to as states roll out their programs for broadband expansion, that we can continue that conversation and be able to share many new opportunities in the affordability area.
I would just like to follow up with that. I think what you said was perfect, Dr. Hayward. What I think you're going to see in the next couple of years, as we start to launch some of these digital equity grants, in rural areas, a lot of times our libraries are our anchor institutions, and that might be the location that's closest to us, and we'll have that consistent broadband. A lot of, like in Utah, we've got a lot of our libraries that what we're investing in is lending services, so that you can be lent a hotspot, you can be lent devices, things like that. And so I think it's going to be kind of a process of pairing things together and taking a little bit from VA, a little bit from maybe the anchor institutions. But I think there are creative solutions out there as we're getting everything rolled out. And then we also have some additional grants that will be coming through to help us see where we're at and see where maybe some of those gaps are. That we can help fill some of those gaps with additional funding.
Yeah, I would say there's definite opportunities for partnership on that. I'm not, and Dr. Hayworth, you can, chime in and say yes or no, or let's look at that, or, but I think there's an opportunity for Tech for Troops to help you with that as well, because we have our ears on the ground as well with the veteran community, and we'd love to be able to have a conversation. Lindsay, Dr. Hayworth, Walter, all of us, as to getting devices in veterans' hands to be able to assume their familiar role, right? Family, whether it's head of the household or the woman's whatever, it doesn't make a difference, but they're able to elevate themselves and their children to that next level. And just a quick story. I was at Fort Jackson a couple of weeks ago, which is in Columbia, South Carolina, and I gave out some computers to or active duty actually. And the 9 guys, and Walter, you can laugh with me. 9 guys were just jerking around, having fun, right? Because they got a computer for their kid. Yeah, they're just having fun. But the one woman who got the computer for her daughter stood there with it in her hand, just staring at it, because she knew this was going to change her kid's life. And she just stood there. And she just stood there, and I put my hand on her shoulder. I said, "It's okay. That's right. This is what we're here for. It's yours. You have any issues, you give us a call." And she literally wouldn't even look me in the eyes. She was tearing up. And I'm just like, okay, don't do that to me, because I'm going to tear up too. I don't need that. But that's the level of change and soul satisfying that what we do as a community, helping out the veterans that are in need, it doesn't get any better than that. And honestly, I'd love to have a conversation with all y'all about how Tech for Troops can support you in your work.
It's going to take a village.
True that.
Yeah, great note to end on. That's such a poignant story. Thank you, Mark. And yeah, partnership is definitely key in this, and I think that's a great note to end on. So with that, I want to thank all of our panelists for a great discussion. I'm grateful to each of you for offering your time and expertise. I know you're all very, very busy. I also want to thank my co-authors of our report, Dr. Hayworth, Deasia Nichols, and Leslie Roos, for their tireless work on this project, as well as countless others who have been involved in this effort from the Department of Veterans Affairs. And finally, thank you to my colleagues at Benton for supporting this project from beginning to end. Thank you all for attending, and please be in touch with any questions. Have a great rest of your day.
It was awesome.
Thank you, everyone.